Thank you, Harvey. Good morning. It's always good to be back for these talks. And so we got two back-to-back that we're going to do. And so the first one we're going to talk about just some research that have come out in the last year. This is an ever-changing field. Stuff that we talked about 2-3 years ago, that stuff's changed. Okay, and so this is something that we have to stay on top of as physicians who deal with this, but then also you guys need to get that information as well too, because if you don't know that stuff, then we're doing stuff that's 3-year-old, 5-year-old stuff, and it seems like, well, that's not that long ago, but in reality, for the research that constantly is being done on concussions, it is something that we need to really be aware of. So I always like to do a little just summary slide, is just kind of my sort of take on concussion. So remember, this is a functioning problem in the brain, okay? So we'd heard about a lot of this stuff that goes on at a very small level in the brain. It's not really a big structural injury. So we're not seeing, like, you know, if we do CAT scans or MRIs like was talked about, we don't usually see a concussion on that, so you can't. And that's because these things are happening at a microscopic level. So when we talk about tests like CAT scans, MRIs, like I said, those are not going to determine a concussion. There's no gold standard test out there for concussion. So don't let any salesperson talk to you about that who's trying to get you to do something at your schools, because there is no one test that is 100% foolproof that'll tell you whether you have a concussion or not. Okay, and so that's, again, the thing to remember here. The vast majority of athletes we see are symptom-free within 3 weeks of the injury, because we're mostly talking about the high school athlete here. We do know that as you get older, we do tend to see recovery times being shorter. Now, part of that can be because a developing brain actually can take longer to get better than a mature brain. And so that's one of the things that's the exact opposite of what we see in most sports medicine things. Usually the kids get better than the adults do for most of their injuries. With the brain, that's not always the case. The current guidelines recommend a 5-step return to play process after they're symptom-free. There's no helmet or protective device that can prevent a concussion. Every concussion is different. I kind of liken it to my patients. They're like snowflakes. No two are the same. So we're never going to see that person have the exact same problems with their next injury. So they can have one that takes them 6 weeks to get better, and the next one takes them 2 days to get better. So they're all different. So there's not this thing where each injury we see gets worse and worse and worse, and they're going to have more and more symptoms. That's one of the misconceptions with concussions, is that that's going to happen. We really have to treat them individually that way too. So there's really not a cookie cutter approach that we want to have as far as treating concussions. And as was discussed, CTE is definitely real, but it's still unclear what that diagnosis means in relation to clinically. So you can have someone who takes your brain, and really the only way you can diagnose CTE is you have to look at someone's brain after they're dead, slice it up, do a special stain on it, and find this deposition of something that's called a tau protein. When people are saying they have CTE when they're alive, that is not a correct thing to say, because we don't know that they have that or not, okay? Because we can't, there's no test to test for that while someone's alive, okay? Maybe we will someday soon, and there's lots of things that are being done around the country to try and find ways to diagnose that problem earlier on. But again, we can't make that diagnosis until after someone's dead, unfortunately. And but it is a real phenomenon. There's no question that that exists. So we'll talk a little bit about some different research things. So this one here is looking at NCAA athletes, but I think it kind of highlights what we've seen in high school athletes as well. So this is looking at the trend over time for returning to play after a concussion. So we have from 2009-2010 season all the way to the 2013-2014 season. And what we see here, the thing that I don't like, is the fact that we still have a percentage of athletes here that are going back less than 24 hours after their injury. Okay? I don't know why that is still happening in this day and age. Okay? That shouldn't be happening. There's no athlete that should go back to play within 24 hours of their injury. Okay? So this is the not great thing about this research here, but one of the things we do see is the trend to take longer to get back to recover. So this bar here is within 1 to 6 days after the injury, so we see that shrinking down and getting to be a much smaller percentage. And now we're seeing the vast majority taking 7 to 13 days before they're getting back to return to play. Okay, and this is at the NCAA level. So that trend is good. Like I said, this trend still is not good. Too many kids are letting go back to play. So it was mentioned earlier about using things like the SCAT-3 or the SAC. And so those are actually sideline assessment tools that we can use to try and help determine if someone's had a concussion. The thing to remember about when we look at these tools is where have they been actually researched, okay? So when we do research on something, and if I research a bunch of football players, I can really only make conclusions about this test is suitable for use in football players. I can't necessarily translate that to a girls soccer player or a boys swimmer, okay? So when we look at this, we have to take the research with a grain of salt. So the studies that have looked at SAC, which is a small component of the SCAT, it's a 30-point test that we would do. The vast majority of the testing has been done on football players, and the vast majority of them have been done on male athletes. So that's one of the big discrepancies we have, and we see this across sports research in general. The female athlete is vastly under-recognized and under-researched in most of the research that we see out there. So again, we can see a lot that's applied to males and football players, but again, other sports we're not seeing a lot. So we've got hockey down here, we've got rugby here, and then there's a mixed percentage here. For at least the SCAT, it's a little bit better because this big pie here is mixed of different sports. But again, we still see the vast majority of the research being done in male athletes. And obviously, there's low-hanging fruit there. Football is the most common sport to get a concussion in. Those are males for the most part, unless you're in Texas, then there's a couple select females there. But for the most part, it's a male sport. So because most of the research is being done on football players, it's most likely you're going to get a concussion in. There's a lot more research you can do on it when you have more exposures to it. We just get skewed that way. But again, you have to remember that and take that with a grain of salt when we look at research. And that's how we have to apply these things. So we can't always apply it to this other population just because it's been done in a different population. So do concussions increase your risk of getting a musculoskeletal injury after you return to play? So this was done by some of my colleagues at the University of Wisconsin. And they actually followed athletes out for 3 months after they had their concussion and looked at the rate of injuries that they had in their lower bodies, so basically from the hip on down. And so they had control athletes, and it was actually done very well, so they actually matched them for their age, for their sex, what position they played in that sport, they matched them for their sport, and they had up to 3 controls matched for every concussed athlete. So they had a decent match of looking at these athletes. So when we looked at them, or when they looked at them, 17% of the concussed athletes has sustained a musculoskeletal injury in their lower body within 3 months after they returned, compared to only about 10% of the controls. So their conclusion was you're 2.5 times higher likelihood odds of getting a musculoskeletal injury after they return from concussion. So why is that? Is that just luck of the draw? Could be. Could also be because they may still have some subtle balance deficits or some other judgment issues when they get back to play that aren't able to be picked up on the things in the assessments that we do currently. So that's a possibility. So we don't know that, but we just know that from this study at least that there is a higher risk in this particular population. Now again, we're looking at athletes in college, and so we need to see research in this done in high school athletes as well. So do helmets make a difference? And so this was actually a really good study, and this is actually done looking at high school athletes that were monitored in what's called the high school Rio system. And so this was actually developed by an individual, Dawn Comstock, and she's done extensive research on the epidemiology, so kind of statistics related to concussions and other injuries in high school sports. So it's a huge database. Lots of high schools participate in this. The athletic trainers send in data. So it's a very robust database that's out there to look at injuries. So they looked from the 2008-2009 season through the 2012-2013 seasons, and they actually had 2,900 concussions over this database that they looked at, so a huge number, and then 3.5 million athlete exposures. So if you're not familiar with research on how we define an athlete exposure, that's an athlete going out to a practice or participating in a game. That counts as one athlete exposure. So if you have 40 athletes going out there, that's 40 athlete exposures for a practice, or 40 players playing a game, that's 40 athlete exposures for a game. And so what they looked at is the number of symptoms that people had, depending on the helmet that they wore, what specific symptoms they had, how long it took to resolve their concussion symptoms, and how long it took them until they returned to play. And they looked at numerous helmet types that are out there, both manufacturers and different models that those manufacturers had. They also looked at new and refurbished helmets, because there's concerns, obviously, you send a helmet in to get refurbished, is it really as good as new? Okay? And what they found is there was absolutely no difference in anything that they tested between any of the helmets, any of the models, and whether it was new or refurbished. So 0, okay? And again, that's one of the things that we talk about a lot, is that, you know, are helmets really going to make a difference? Well, you already have technically a helmet on your head, okay, your skull, okay? That is meant to protect your brain. So now if I put another skull on top of a skull, well, even if I get hit, it's great for protecting the skull now from getting skull fractures. The problem is it still doesn't keep the brain from moving inside the skull. And that's the problem. So, you know, we talk about the 3 highest sports to get concussions in. It's football, ice hockey, and lacrosse. Well, what's the 3 common denominators of those? Helmeted sport, helmeted sport, helmeted sport. Okay? So if helmets were that great, those should actually be much lower than the non-helmeted sports, but we don't see that. Okay? So maybe there's an awesome engineer out there who's going to design something that's going to help reduce some of the force that the brain happens, and there's lots of different types of helmets that they're using. They had a new helmet that I think some of the players throughout the NFL wore this season that's designed to kind of like collapse, so to speak, or inside to help reduce and dissipate some of the forces. I'll be interested to see what their research was on that came out over the year. That helmet cost $1,500. So really it's an NFL or a professional sport level type helmet purchase. But again, we still don't have the research to show that those are any better. And right now, honestly, it's a crapshoot as far as you're going to have your kids wear. The most important thing in my mind is fit. Okay, if it's not fitting properly, it's not going to work for them. So playing through the injury, is that good or bad? So this first study that I'll talk about looked at, again, college athletes. And so they took 50 of them who delayed reporting of their symptoms, because obviously it's an easy injury to hide. Not everybody's going to stumble and fall after they have their concussion. They may just have a headache, and you can't see the headache from the outside when we're looking at that person, so they can hide it. So they looked at those who delayed reporting of their concussion compared to those who immediately reported their symptoms. And those that actually had delayed reporting took 5 more days longer than those who had been immediately removed from play. And it was the same whether we controlled for any other variables, whether it was male or female, their prior history of concussions, whether they had any underlying learning disabilities or attention deficit disorder. And the delayed reporters were 2 times more likely to take longer than 8 days to recover. And that's one of the things that I certainly see in my office when I see these kids. The kids that continue to play have worse symptoms and take longer to get better than the kids that come out immediately. Okay? So, and I've talked about this before at this conference. One of my favorite posters is related to concussions. It's better to miss 1 game than miss the season. Okay? And that's a true thing. So again, that's where it is imperative on coaches to create a culture in their sport encouraging reporting of the symptoms. Okay? When that's not happening, then this injury is a very, like I said, easy injury to hide. So how about high school athletes? So they did a similar study that was actually just published. So they took 35 who were immediately removed. They put them in what's called the remove group, and 34 who continued to play, so in the play group. So the ones that continued to play took an average of 44 days to recover. The remove group took 22. Okay? So you're 8.8 times more likely to have a recovery lasting longer than 3 weeks if you continue to play after your concussion. Okay? And they also had worse performance on their neurocognitive testing, so things like impact, and worse symptoms than the remove group. So again, stuff that we've seen clinically for a long time. Now there's research to back that up that this absolutely is truly the case. Okay? So this is, again, why you don't want your kids continuing to play. And if you have any kids that you're concerned about it, keep them out. Okay? It's the when in doubt, sit them out. Keep that phrase in line. It doesn't matter if they tell you they're fine. Okay? Because if you're a coach and you ask, how are you feeling? I know what your athlete is going to tell you. I feel fine, coach. Let me play. Okay? And that's the thing I stress with these athletes when I do see them in my office when they're continuing to play after their injury. I go, if I was on your sideline and you told me you felt fine, that doesn't count. Okay? Fine does not mean normal. Okay? There are 2 different things for an athlete. Okay? So don't, if you're a coach on the sideline or you're taking care of any kids and you're evaluating them for a possible concussion, never accept the word I'm fine from an athlete. Okay? Because like I said, fine is not normal. Okay, and I've seen that a zillion times, okay? They want to play, okay? They don't want to let you down as a coach. They don't want to let their teammates down. They don't want to let their parents down. They want to be in the game, okay? They don't want to get taken out. So like I said, just ask them those other questions. Don't let them just say they're fine. I'm going to want to go back and play. Because time and time again, that's what I hear in my office. So what do athletes have concerns about their concussion? So this was actually just looking at a survey as far as what do they feel is the worst part about having a concussion. So they had the option to answer both of these questions, whether it was their symptoms or the fact that they were out of activity. So about half and half, but 14% of them both said symptoms and their loss of activity were their worst things that they had. But this is not the thing I want to take away from this. What I want to take away is some of the free text comments that athletes could say about their concussion, because I think it's important to understand what does it mean to these athletes, okay? So a lot of them talk about symptoms, so headache, fogginess, miserable, falling behind in schoolwork, bored, no fun, having to be on brain rest, it's very boring, okay? Can't do anything, can't drive, can't watch television, use my phone, play sports. Depression issues, low energy, insomnia, not being able to keep up in school, not being able to go to gymnastics or soccer, not being able to be with friends. Okay, feeling tired all the time, not being able to do anything, The last one, I'm not allowed to do the things I love, okay? So these are things that we have to be cognizant about when we're counseling athletes about what to do and when we're asking them about what's going on. Because I do see after kids have been out for a long time, they do start to get very depressed and very anxious, okay? And that's a whole different animal to treat in a young athlete than their concussion is, to be honest with you. So what about the risk of problems later in life? And there's lots of studies that have actually started to look at this, and lots have come under criticism about how they've been done. This was a study that was literally just published last month, and it looked at football players from 1956 through 1970 in Rochester, Minnesota. They had data on these athletes, and they compared them to varsity swimmers, wrestlers, and basketball players. So those athletes that are at a lower risk of getting a concussion, they can still get them. Certainly we see them in those sports. As we would expect, head injuries were reported most likely in the football players. They had 300 football players, about 200 of the other athletes. And there was no increased risk in football players of any neurodegenerative disease, and specifically dementia, Parkinson's, and ALS. It's actually kind of interesting, because this is an era where the injury wasn't really taken super seriously. But they found in this group in Rochester, and again, we can apply it to Rochester in this select group, but they didn't find any increased risks of neurodegenerative problems. And that's one of the things that, there's a lot of media attention around CTE and things like that, and that's what I hear a lot of questions about in my office, is that this is a, if you have a concussion, you're doomed to get CTE. That's absolutely not the case, okay? I mean, there have been millions and millions of players who played football over the years, okay? If CTE was as often as they're saying that it is as a problem, or at least the media is portraying that it is, we should have hospitals riddled with mentally disabled athletes, okay? Because I'm sure many of you in the room played football when you were younger, okay? So again, we have to take these things with a grain of salt. We need more research, okay? And again, like I mentioned earlier, this is definitely a real phenomenon, but it's not an epidemic where we're seeing that this is a huge, like tons and tons and tons of people are going to have permanent brain damage as they get older. So how safe is football? So this is just looking at deaths. Okay, because that's the worst consequence of all this, okay? You get a concussion, that's fine, but if you die on the football field, that's a whole different ball of wax, okay? So they looked at traumatic brain and spinal cord injuries in high school, so they eliminated all the other things. So there are actually a lot more deaths that have happened on sports fields than just brain injuries. So these are just isolated brain injuries, and that's one of the things that we see a lot. There's about 7 or 8 kids that we hear about every fall that have died on the football field from various reasons, Brain injuries and neck injuries or spinal cord injuries can be one of those, but we see heart problems that were undiagnosed during their pre-participation examination. Kids who have aneurysms in their brain that we can't figure out ahead of time. Okay, those types of things that are just unfortunate events that happen for those particular people, but they're not the brain injuries. But again, that's the automatic default. You played football, you died, it was because you had a brain injury because of that. So that's not the case. So over a period of almost 10 years in high school, there were 24 deaths reported. 58% of them over the last 5 years. So again, we're looking at a 10-year period, slightly more the last 5 years. And in college, there was only 4 deaths. Okay, so again, we have to take these things with a grain of salt. These are unfortunate incidents that happen, no question about it. We never want to hear about any athlete dying on a football field or dying on a basketball court or what have you. Okay, but again, it's not huge. We'd like to have this number 0. Okay, but one of the things that we talk about, so this here. If we bring this up and we have this much attention to football, why aren't we paying as much attention to suicide rates in kids in high school? Okay, which that happened in the last 2 months in the state of Missouri. Okay, so again, it's things that we have to put in perspective as far as where are we putting our time and effort towards, and what do we get all riled up about. So about new guidelines in 2017. So it was mentioned earlier, the Concussion in Sport group. They had their 5th symposium actually in Berlin last October, so we'll probably have some new what are called the Berlin guidelines, replacing what were called the Zurich guidelines before. From what I have heard, there's probably not going to be any big dramatic recommendations outside of encouraging earlier physical activity after the injury, not returning to play, but earlier getting back to being active. We're currently revising the American Academy of Pediatrics guidelines that we initially published in 2010. That should come out probably this fall. And then there were some guidelines that came out related specifically to head injuries in pediatric age patients from the CDC that I was part of, that was released at the end of 2016. And so that includes all different types of things, not just sports from head injuries. So those are resources that are out there or will be coming out just to keep in line of what are going to be the current and newest guidelines that are out there.